you pulled up some stats, David, that still a lot, but only
Yeah.
2% currently of Australians are apparently on a GLP-1. It's still
Yeah.
massive explosion in the last 2 years, but compared to America, these stats say 6 to 7% of the US population. So even if you've noticed a massive change and it's only 2% of Australians, when it's, I don't know, 5 or 10%, it's going to totally change your practice.
Yeah, I think in the next 5 years, all plastic surgery practices around the world will be redefined, recalibrated based on the use of this medication. Especially, as you guys know, the oral tablet version just got approved, FDA approved in the States, Ozempic tablet. And that's just going to open the whole paradigm of patients who probably for many reasons did not want to use an injectable means of losing weight, taking a tablet daily.
Yeah.
That's just going to open up another section of patients which weren't privy to the world of plastic surgery. Look, I think still there are a lot of patients who are using GLP agonists and not seeking plastic surgery. So the main benefit of this medication is health, lowering your cholesterol, stabilizing your sugar, reducing your cardiovascular risk, and so on. So let's not lose the big picture that these medications are prolonging life and longevity. And I think it's quite interesting that as people live longer, and that's where the long-term plastic surgery kicks in. So I always look at this as a short-term gain, which is what we discussed the other day. Short-term has been a big increase in demand this year. I'd say at my practice, probably about 10-20%, which is quite reasonable. But I think long-term patients are going to live longer. That's very simple. A 60-year-old getting a breast augmentation is not going to be a weird thing anymore. A 75-year-old getting a facelift is not going to be weird, because a 75-year-old doesn't necessarily look old anymore. Or in fact, they feel great about themselves. They feel healthy. Heart's working perfectly. Everything's looking good. The risk of dementia has been known to be reduced by reducing obesity. So people living longer, they're going to be needing more plastic surgery, and plastic surgery will go well into the 7th decade and maybe even to the 8th decade, where 80-year-olds are getting facelifts.